Hey guys, happy Friday and happy Veterans Day. I hope you guys are doing well. My name is Huang. I am an occupational therapist and certified hand therapist, and one of the things that I do is to help OTs and PTs study and pass the boards to become a certified hand therapist. So if this is the first time you're tuning in, then hello, welcome. If you're an occupational therapist, if you're a physical therapist, and you're interested in becoming a certified hand therapist, then I can help you. One of the things that I've been talking about over the last several weeks is really about, how do you increase your marketability as a therapist? How do you improve your skills? How do you study to become an expert in your area, to become a certified hand therapist? And one of the things I wanted to talk to you today is, one of the things I hear often with therapists who want to become a certified hand therapist but keep putting it off. It's because one, they don't realize that they actually qualify to sit for the exam. You have to have the years, you have to have the hours, but the most important thing is to have the desire to become an expert, to have the desire to, to really invest your time and money. And really so much of it is your effort, right? Your effort in order to become a certified hand therapist, because outside of the years, outside of the hours, you have to have the desire, because it does take work to study for the exam. And one of the things I've been talking about all week is how to essentially make it easier. There are ways in which you can study so that it's easier. You can break it down so it's easier. I know that forever, people who have been in hand therapy have been saying how hard it is. And I just think that we're in a time and age where, we have a lot of accessibility. There's a lot of technologies that connect us, no matter where we are in the world, in order to essentially improve our skills and just be able to help more and more people. Thank you, Allison, for joining, because I do want to talk about, are you losing your jobs to physical therapists? And really, it's not just physical therapists. There's other people. There's other people in the industry that are talking about how they can cure pain. I was just working with someone today who came in. She has rheumatoid arthritis, really young woman, and she has gone and done acupuncture. She has gone to a massage therapist. She has and now she just found my clinic on Google. And as an occupational therapist, we can get mixed up with being a physical therapist. And she's like, well, I've never done physical therapy before. Well, great. Well, that's really great. I'm an occupational therapist and you're in the right place. I can help you. And basically went through what was going on, what she was not able to do from a functional standpoint, but what she couldn't get to do from a biomechanical standpoint. When you study to become a certified hand therapist, and I think as occupational therapists, we have such an opportunity, because majority of all the people that we work with have 2 hands and 2 arms. And it really doesn't matter if you're working in an outpatient setting. Majority of OTs that go and become a certified hand therapist, you do, most of us want to work in an outpatient setting. But, if we're working with people in the home, right? Outpatient in the home. If you're working with skilled nursing people who live in a facility, in an independent facility, in a nursing facility, in a hospital setting, these people that you're working with all have hand and arm injuries. I have been working with people with rheumatoid arthritis since my days in the hospital, since my days in a skilled nursing facility. And I continue to work with them from an outpatient standpoint. But really, one of the reasons why it's so important. Oh my God, my son. He's on the. I'm on live. I'm on talking to people on Instagram.
That's cool.
What was I saying?
I shot up my friends.
So yes, you did. Hey, we're leaving in 30 minutes.
Yeah.
Gotta go shopping. Take him to a birthday party today. So, one of the reasons why I keep talking about like the importance of studying for the exam, and really not just even studying, the studying part to become a certified hand therapist is really just so that you increase your awareness to improve your critical thinking, look at a particular problem based on how that patient comes to you, be able to think through the particular problem and help your patient solve it. So my patient came in, she has a history of rheumatoid arthritis, but really what was going on was her disease process had already stiffened up her wrists, right? And then she's sort of getting a flare up of her elbow. And she's starting to feel a lot of things and a lot of tightness and pain in her shoulder. So she's gone to acupuncture, she's gone to therapy. And one of the most important things when you start to study is you start to understand just not what to do or how to do it, because a lot of times therapists, we're coming on here, we're looking at like, what did you do, where are you putting your hand, what activities, what exercises, all those are grand and wonderful, but we really have to come back to why we're doing what we're doing, right? And having a fundamental understanding of it. Understand fundamentally what rheumatoid arthritis is. Rheumatoid arthritis is an autoimmune disease. At its most simplest form, it's an autoimmune disease. It is one type of arthritis where the body attacks itself. It attacks itself very specifically at the joint, right? We as therapists, we cannot do anything about the rheumatoid arthritis. So my point to her was like, I'm not here to solve, I'm not here to make your rheumatoid arthritis go away. That's not I can't do that. But what I can do is find out and figure out based on the symptoms that you're coming in for, right? So you're losing your motion. Where are you losing your motion? When you're losing your motion in one particular area, what happens is you can gain too much motion somewhere else. And so what was happening is she started to lose elbow range of motion. And it's not just flexion and extension. She was losing her range of motion in supination and pronation. So when I was like, okay, so tell me or show me, not tell me, show me what you're having a hard time doing. She was having a hard time actually getting her hand surface touching behind, so she could put her hair up a little bit and all that good stuff, but just kind of getting behind her neck or just being able to go like this, hi. That was really tough, really painful. And as she worked and as she did stuff, she was starting to feel a lot more elbow pain. And the elbow pain was now starting to creep up and she was feeling really tense in her shoulder. So in doing the therapy treatment, understanding the disease process, understanding the symptoms, like where's the restriction in range of motion. So if there's a restriction in range of motion, is there pain? Where is the pain? When does it come? How does it come? So that we can essentially be able to work to get more of the motion back and then be able to resolve some of the pain issues, get those muscles moving, and find out where the imbalances lie, right? Because when rheumatoid flares up, what it does is it attacks a joint at the joint level. So what happens at the joint level? So the ligaments aren't right, the joints might be out of alignment, the muscles aren't moving well. And so what we have a chance to do is to really work with the symptoms that someone presents to us. And then we could we could work with them to say, okay, well, one of the things that I told her was we want to work in a very gentle way. So stretching in a very particular direction is going to be more helpful than just jamming it. So if flexion is painful, but you've also lost extension, let's work into some extension. And it does not need to be hard. It does not need to be aggressive. And she was just really emotional about it because I don't think that she'd been anywhere where someone spoke to her in a way that they understood the disease process and what she was needing in order to ensure her the longevity of how she could use her arms. Young woman, right? So we're really not talking about modifications. We're really not talking about, oh, like, your shit's all bad right now. Like, and one of the things that she mentioned to me was like, I don't want to hear about how bad my wrists are. I'm like, that's not coming from me. We're just going to look at what you have, and we're going to get you more of what you got possible. And then we're also going to look at what we can prevent, right? So it's not that I can stop the disease process, but I can anticipate the problems that come, right? I can anticipate the problems that come, and I can slow them down. I can try and work with you to slow them down, right? So when you're studying to become a certified hand therapist, so much about what you do is about how to critically think. You have to know anatomy. You have to know how the joints move, the biomechanics, the kinematics of it, the muscles that move, that play a role in how the whole arm works. Then you have to be able to apply it to know how to test. What are the things that you're looking for? Prognosis is really about, can you anticipate these problems? What is she allowed to do? What is she not allowed to do based on her history and her, her story, the onset, and all that good stuff. And then we have to provide the appropriate treatments that actually get the outcome that a patient's coming to see you for, right? Not everything is about splints, but sometimes splints are needed, especially when you're talking about someone who has rheumatoid arthritis. And it's not just to stop the pain or your typical wrist splints, but it might be a splint to help prevent something from happening. So when I talk about are you losing your jobs to other therapies, other services? And part of it is yes. If you don't know what you're doing and you don't know how to communicate in a way that helps you to get buy-in from your patients, so that they stay with you, so that you can help them get results, you are losing opportunities. When someone goes to a chiro, a physical therapy, even stretch zone, for God's sakes, a massage therapist. So, all of those, they all have a role to play. Just like we as occupational therapists, we have a role to play. We have a way that we can, help our patients. But the way we help our patients is in how we can critically think through what is going on with them, so we can make decisions about what needs to happen to get them the best possible outcome, So it's really about losing the opportunities, right? So it's not necessarily just losing the job to the physical therapist, but, do you know how many physical therapists that I'm networked with ask me about trigger finger, right? They ask me about trigger finger. What am I supposed to do? What's the best treatment for this? And it's not, it's not that you can't do it either. They can do it, you can do it. Just like you can work with the wrist, you can work with the shoulder, you can work with the neck. It's just whatever you're willing to learn, whatever you're willing to put the effort in to become an expert at, that you can become, where you can have an opportunity to help more and more people that are in your area and be an expert. People are going to come to you because they know and they understand that you know how to help them. So don't let the opportunities pass you by if it's something you desire to excel in, right? Because at the end of the day, we are competing with massage therapists. So let me tell you the story of her going to a massage therapist, because let's face it, freaking go to a great massage therapist and they feel wonderful, right? Who doesn't love a great massage? But massage, you should go to feel really good. Massage isn't always necessarily about fixing a particular problem, right? Because they tend to work the whole area. And one of the great things about occupational therapists, if you know how to do this, is to get to the root cause of the problem. So in evaluating my patient with rheumatoid arthritis, where she has a stiff elbow, stiff wrist, but a very loose shoulder, very hypermobile shoulder, right? So the massage therapist that she went to said, oh, you're really stiff. Hold on to a weight and just dangle your arm to stretch it out. When in essence, that is the thing that's going to make her worse. If you're hypermobile in your shoulder and you don't have stability and you stretch the shit out of it, it's going to hurt more. You need actually more stability. And actually in stretching out her elbow, joint approximation actually was more pain relieving than joint distraction, right? So, when you're working with someone, you have an opportunity to test, right? You're evaluating what's going on, what's going wrong, and because you understand the nature of the injury, and here this is the nature of a disease process, you know where the particular problem is. So I've got no elbow extension. I'm losing end range extension. I'm losing end range elbow flexion. I'm losing supination and pronation, but then I've got way too much shoulder motion. No stability. So what are the things that we need to work on? Well, we've got to work to reduce a certain amount of pain because with arthritis, stretching into pain is not good. So we talked about how she can, help herself with 1 to 2 exercises, right? And one of the things that I do is I like to pick the easiest thing for them to do, not the hardest thing. Remember, rheumatoid arthritis affects both hands. So when you have one arm, you try to make the other arm do the work, it's really tough, right? So, really have to keep those things in mind when you're thinking, oh, let me give them a home exercise program. Of course, it's important to them, but this is my own standard, is picking 1 to 2 things that I find very effective in the treatment and saying, if you could just do this 1 to 2 things, that's all you're going to do. And when you come back to me next time, we'll be able to advance that. And we'll be able to see how much you're able to improve, right? So yeah, just keeping those things in mind and being able to think through the particular problems is where you have an opportunity to gain back, the ability to treat patients, to raise your hand and say, I know how to treat this particular type of injury. I know how to work with these type of cases so that I can have more opportunities. You're not going to lose your jobs to other industries, to other people, as long as you have the skills. Having a degree as an occupational therapist and having a degree as a physical therapist does not guarantee you a job. It really doesn't. Now, you can get a job. You can get a job, but it doesn't guarantee you one, and it doesn't guarantee you a position or a career where you want it. You have to work towards it, and you have to essentially be brave to say, I need help. I really want to work in this particular area. I really need help. I really want to work and specialize in hand and arm injuries, because one of the reasons why I love it is because I like the technicality of it. I like the, how technical therapy can be or is required of your critical thinking in order to solve some of the most complex injuries, right? So I like that. Some people don't really necessarily enjoy it, and I think that that's okay. We all have to want and do different things, but I know there are so many occupational therapists and physical therapists too that really would like to work in the area and be specialized in working with hand and arm injuries, right? And I say hand and arm injuries because it's not just the fingers and hands, it's not just the wrist, it's not just the elbow, it's the shoulder too. And all the nerves that come out of the neck come down the shoulder and come down into your hand so your hand works. If all of that is all messed up, then nothing's working really well, right? So part of studying to become a certified hand therapist really allows you to be a better clinician. I know when I studied for it almost 20 years ago, it really changed how I saw injuries. It really changed how I problem solved, so that I wasn't just copying what I was seeing, but I was really truly understanding why I was doing what I was doing. So if you're out there and you don't want opportunities to pass you by, right? You don't want to continue to wait to enjoy your career. You want to start now. If you're working in outpatient, you're working with people with hand and arm injuries, you have the years, you have the hours, and you're just a little bit intimidated by the exam, I can help you. The exam prep program is currently open right now. So if you're on Instagram, just click the link and it's going to describe to you what the exam prep program is really all about. And it's really about helping you prepare in less time. So if you're kind of struggling with preparing, knowing what to do, how to go about doing it, click the link in the bio, take a look what the program can help you do. One of the things that I really love is, as I spend time teaching it, is trying to take complex concepts and just simplifying it so that you can have a easier, better understanding of it before we make it complex again. But give yourself a chance, really give yourself a chance. If it's something that you want, I promise you that feeling never goes away. I've met so many therapists, talked with so many therapists, and it doesn't matter how many years that they've decided to put it off. At some point in their career, they're like, you know what? I've been putting it off and putting it off. I really want to do it. It's a career goal to become a certified hand therapist. And they know that at the end of the day, that's going to help them become a better clinician. And so click the link in the bio and apply for the exam. It doesn't guarantee that you're going to get in, but at least it gives us an opportunity to talk to you what the program is about, but really gives us an opportunity to see how we can help you, how I can help you create a plan. I actually spoke to someone who she's not quite ready for the exam prep because even though she has the years, she doesn't yet have the hours, at least not yet. And going into and then she has a new job and all this other stuff. And it's like, if you come into the program, then it's going to be so overwhelming because you're doing so many other things and you don't yet have the hours. It's better to get started this way. So we created a plan for her that's going to help her be more successful. So there's actually no risk involved in applying for the program and seeing whether you qualify or not and if it's a right fit for you. But at least, create a plan so that you don't keep putting off becoming a certified hand therapist. It's such a great feeling to be able to work in an area that you love, to be able to have a lot of fulfillment by the people that you help. So I hope that you consider it if it's something you've been thinking about. All right, so stop losing opportunities in your career to other therapy providers to do well. All right, so I'm gonna get going. Gotta get ready to take my kids out, and my phone is dying. that doesn't help. But listen, if anything resonates with you and you have questions about it, by all means, send me a message, direct message me, and I'm happy to talk to you guys. All right. My goal is to talk to as many OTs as possible in the next few remaining days that the exam prep program is open. So I'll talk to you soon. Thanks, guys. Bye.